This video is about the fascinating development of medicine throughout history. I will explain how medical knowledge and practices evolved from the ancient Egyptians through ancient Greece and the Roman Empire to modern breakthroughs in science and technology. Over 4,000 years ago, Egyptians treated diseases with herbs and magic. They performed simple surgeries like setting bones. The Ebers Papyrus described remedies and illnesses. Doctors were often priests. Medicine was closely linked to religion. In the 5th century BC, Hippocrates made medicine more scientific. He believed diseases had natural causes, not divine ones. His oath set ethical rules for doctors. He carefully observed patients. Hippocrates is considered the father of medicine. In the Roman Empire, Galen improved medicine. He studied anatomy through animal dissections and wrote many books. Romans built hospitals for soldiers. Hygiene, such as aqueducts, was advanced. Galen's ideas influenced medicine for a long time. In the Middle Ages, medicine in Europe stagnated. Monasteries preserved ancient knowledge and cared for the sick. Diseases were often seen as punishment from God. Herbs and bloodletting were common treatments. Progress was slow. From the 8th to the 13th century, medicine flourished in the Islamic world. Doctors like Avicenna wrote works such as the Canon of Medicine. They performed surgeries and studied anatomy. Hospitals were modern. Their knowledge later reached Europe. In the 14th century, the plague killed millions in Europe. Doctors did not know how to stop it. Quarantine was introduced to prevent spread. The plague revealed the limits of medicine. It led to new ideas. In the 15th century, the Renaissance began. Andreas Vesalius dissected corpses and corrected Galen's errors. His book De Humani Corporis Fabrica was groundbreaking. Anatomy became more precise. Medicine became more scientific. In 1628, William Harvey discovered the circulation of blood. He showed that the heart pumps blood. His work disproved old theories about blood. The discovery was a milestone. It helped to better understand the body. In the 17th century, Antony van Leeuwenhoek saw bacteria through microscopes. His discoveries revealed tiny living organisms. Later, germs were linked to diseases. Microscopy changed medicine. It made the invisible visible. In 1796, Edward Jenner developed the first vaccine against smallpox. He used cowpox to protect people. His methods saved many lives. Vaccinations became an important tool. They shape medicine to this day. In the 1840s, ether began to be used as anesthesia. Surgeries became painless, making operations safer. Doctors like James Simpson introduced chloroform. Anesthesia was a breakthrough. It enabled complex procedures. In the 1860s, Joseph Lister introduced antisepsis. He used carbolic acid to disinfect wounds. This reduced infections after surgeries. Hygiene became standard in hospitals. Lister's work saved countless lives. In the 1860s, Louis Pasteur proved that germs cause diseases. Robert Koch discovered bacteria like the tuberculosis pathogen. Germ theory explained infections scientifically. It changed medicine fundamentally. Hygiene became central. In 1895, Wilhelm Röntgen discovered X-rays. They made bones and organs visible without cutting. Doctors could better diagnose fractures and diseases. Röntgen won the first Nobel Prize. His discovery shapes medicine. In 1901, Karl Landsteiner discovered blood groups A, B, AB, and O. He explained why some blood transfusions fail. His work made transfusions safer. Blood groups are now standard. They save many lives. In 1928, Alexander Fleming discovered penicillin. It was the first antibiotic against bacteria. In the 1940s, it was mass-produced. Antibiotics revolutionized medicine. They fight infections effectively. In the 1950s, modern heart surgery began. Doctors like Christian Barnard performed the first heart transplant in 1967. Heart-lung machines made surgeries possible. Heart surgery became more precise. It prolongs life. In 1955, Jonas Salk developed a vaccine against polio. The disease paralyzed many children. The vaccine stopped epidemics worldwide. Vaccination programs became standard. Polio is nearly eradicated. In 1953, Watson and Crick deciphered the structure of DNA. Genetics explained how diseases are inherited. Later, researchers found genes for diseases like cancer. Genetic medicine grew. It changes diagnosis and treatment. In the 1970s, magnetic resonance imaging, or MRI, was developed. It shows detailed images of organs without radiation. Doctors diagnose tumors or injuries precisely. Imaging is indispensable today. It makes medicine safer. In the 1960s, organ transplants became more common. Kidneys, livers, and hearts were transplanted. Medications prevented rejection. Transplants save lives. They are routine today. In the 1980s, AIDS was recognized. Researchers found HIV as the cause. Antiretroviral drugs made AIDS treatable. Virus research grew rapidly. It helps with new diseases. In the 1990s, gene therapy began. Researchers altered genes to cure diseases like cystic fibrosis. The technology is still young but promising. Genetic engineering changes medicine. It offers new hope. In the 1980s, minimally invasive surgery started. Doctors operate through small cuts using cameras. Patients recover faster. Laparoscopy is now standard. It makes surgery safer. In the 21st century, personalized medicine grew. Treatments are tailored to a patient's genes. Cancer therapies became more precise. Genetic tests aid diagnosis. Medicine becomes more individual. In 2020, researchers developed mRNA vaccines against COVID-19. They were produced in record time. Vaccines partly stopped the pandemic. Research responded quickly. Medicine showed its strength. Since the 2010s, AI helps in medicine. It analyzes X-rays or predicts diseases. AI supports doctors in diagnosis. It makes medicine more precise. Technology changes the future. In the 2000s, telemedicine grew. Doctors consult patients via video or apps. It is especially useful during pandemics. Telemedicine reaches remote areas. It makes healthcare more accessible. Medical advances raise ethical questions. Should genes in embryos be changed? Organ donation or euthanasia are controversial. Ethics protect patients' rights. Medicine needs clear rules. Medicine saves lives through technology and research. Vaccinations, surgeries, and gene therapies are standard. Global health remains a challenge. Medicine is becoming more digital and precise. It improves the world daily.